Simplified explanation. Liquefactive necrosis is a type of cell death where tissue becomes soft and turns into a liquid-like mass. It usually happens in two main situations. Bacterial infections, where neutrophils, a type of white blood cell, release enzymes that break down the tissue. Infarcts in the brain, where the soft nervous tissue breaks down quickly after losing blood flow. In the early stages, you see cellular debris and macrophages trying to clean it up. In the later stages, especially in the brain, the area becomes a fluid-filled cyst or cavity. When it's due to infection, the tissue is full of neutrophils and dead cells. USMLE Question 1. A 68-year-old man has a stroke that leads to infarction of part of his cerebral cortex. Weeks later, imaging reveals a fluid-filled cavity in that area. Which of the following types of necrosis is most likely responsible? A. Coagulative necrosis. B. Liquefactive necrosis. C. Caseous necrosis. D. Fat necrosis. E. Fibrinoid necrosis. Correct answer, B. Liquefactive necrosis. Explanation. In the central nervous system, infarction typically leads to liquefactive necrosis, where tissue is digested into a fluid-filled space. Why not the others? A. Coagulative necrosis occurs in most tissues except the brain. C. Caseous necrosis is seen in TB, not strokes. D. Fat necrosis happens in fat-rich tissues like the pancreas or breast. E. Fibrinoid necrosis occurs in blood vessels. USMLE Question 2. A 40-year-old woman presents with fever and swelling in her thigh after a skin infection. Imaging shows a pus-filled area. What process is most responsible for the destruction of tissue in this abscess? A. Apoptosis by cytotoxic T cells. B. Ischemic damage with preserved tissue structure. C. Release of digestive enzymes from neutrophils. D. Autoimmune reaction involving immune complexes. E. Lipid peroxidation due to oxidative stress. Correct answer, C. Release of digestive enzymes from neutrophils. Explanation. In bacterial abscesses, neutrophils release lysosomal enzymes that break down tissue, leading to liquefactive necrosis. Why not the others? A. Apoptosis is clean and does not cause pus or inflammation. B. Preserved structure is seen in coagulative necrosis, not abscesses. D. Immune complex injury is related to vasculitis, not abscesses. E. Oxidative stress can damage cells, but abscess formation is primarily enzyme-driven.